want to talk about the Achilles tendon. The calcaneal tendon is what I think we call it. Tell me what its purpose is, where it is, and what happens if something goes wrong.
So basically, the Achilles tendon is the main plantar flexor for the foot. So like you said, it attaches to the calcaneus or the heel bone. And so as you walk or run or push off, it gives you that strength.
So it's behind here and it makes the foot go down, sort of thing.
Correct. It's right behind the ankle.
So what sort of situation makes it tear?
So basically, usually you'll see it in athletes. So someone that has a fast spring off or a fast push off, like in basketball, volleyball, soccer, those kind of things.
Somebody's going boing.
Exactly.
And that tears it off, or may you get a partial tear? Do you have all those?
Most of the time you'll get a full tear, and it's usually proximal to where it actually inserts into the bone, because there's a weak area through that area where the blood supply is not as good. And so most of the time you'll get a complete rupture. Occasionally you can get a partial rupture.
What age, when you're talking about athletes and you're talking an area that has less nourishment, less vasculature, so are we talking about older young people or younger people?
We'll say older young people, about in their 40s, so very young, getting younger by the year.
Young, yeah. So when they completely tear, that means it's no longer working at all.
Correct.
Can you get a partial tear?
You can get a partial tear, but it's much more unusual.
Okay, so what do you do with a complete tear? It just cuts it in two. Is it jagged usually, or is it usually bingo, pretty smooth?
Usually it's jagged, almost like little, we call them mop ends. So oftentimes you'll have a little bit of tendinopathy, which is changes to the tendon first. So you have some scar tissue through that area. So as it pulls apart, it kind of shreds. And so you have these little mop ends to it. So it's rarely a nice, fine kind of cut through that tendon.
So can you use physical therapy to get that one better, or is that one going to need surgery?
Unfortunately, physical therapy is not going to do you much good, because you have to get those two ends back together to heal. And you can do that with surgery, and some people choose to do it without surgery and just with casting. So there are options.